Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today I'm joined once again with Dr. Christopher Chen, the CEO at ChenMed. How are you today?
Jared, it's great to be here.
It's always great to have you back on. Every time you come on, I learn several things that I did not know before, and I also see things in a different light, which is definitely a skill that you have. So I appreciate that.
No, really glad to be here. And this is exciting. This is such an exciting time, and I think we're at a pivot point in our country today. So the more that we can get the message out, and the more that people understand what the potential alternatives are, the better.
Absolutely. And last time you were on, you and I talked a little bit about kind of the future of value-based care. And today, the topic at hand is, and some people might like this phrase, some people might not, but what it is doing is good for everyone. Disrupting healthcare is the core topic today.
Yep.
And I know other people always say, some people say, I don't like the word disrupting, or at the end of the day, they just want to see healthcare change, right? So that's really what we're talking about today. So people keep saying that phrase, disrupting healthcare. Can you tell us what that means to you, and really what you and the ChenMed team are doing to disrupt healthcare?
So, at ChenMed, we talk about changing or disrupting healthcare every day. We believe that we are, a leader in disrupting healthcare. And anytime you're trying to change or disrupt something, it's very, very scary, especially for those who are in power, right? So people who are in power, who are generating all the profits, who have all the wealth, it's most scary to them, right? They already have everything. So the current healthcare system today is about $3.8 trillion. The problem with healthcare today is it only works for a few people. In general, it doesn't work for for a lot of people. And so at this point, when you're talking about an industry that's that size, $3.8 trillion, it's really going to be up to those who are the most courageous to actually disrupt the system that leaves so many Americans out in the cold. And you need to find those people who believe it's a moral imperative to make a difference. ChenMed, if you just go back into our history, we actually turned away from the existing fee-for-service model or fee-for-service model. Clearly not free for service, it's the exact opposite. It's a fee-for-service model. Because it actually promotes a culture of sick care where, the currency of billing and success is based on how sick a population is. The sicker the population, the more revenue and the more potential for profits. And that's a really perverse incentive. I have an ex-executive that used to work for me, and he actually left a children's hospital because their CEO at one point took everybody to the top floor to celebrate. And I said, well, why? He asked, why are we celebrating here? He goes, we nailed it. Our entire ICU is full and our burn unit is full. And that's for a children's hospital. So he saw that there was just such an overwhelmingly perverse incentive for the existing folks who are in power today. So as a disruptor, we embraced the full risk capitated model. So instead of the currency of billing and transactions and volume and celebrating when people get sick, we try to figure out how to deliver better outcomes and get paid for those better outcomes through a currency of influence and coaching of our patients. And so our goal is, of course, to reduce ER visits, to reduce hospitalization rates, to reduce catastrophic events, the very thing that our systems today financially celebrate.
Appreciate that ChenMed perspective, and also just what you guys are doing, as well as what it means to you, right? The whole phrase disrupting healthcare. Now, that being said, I recently put up a poll, and I said, it's 10 years from now, you wake up not feeling well. And I put some of the big tech companies in there, and then everyone else, right? Because I feel like there's a few big names in tech that are trying to go disrupt healthcare. The Apples, the Amazons, the Walmarts, to even, I wouldn't even put Walmart so much in the tech side of things, more in the clinics. But, in 10 years, where would you be going for your care? You're going to be going to one of those big tech companies, or you're going to be going to someone else. And right now, it's still early in the poll, but most people are clicking somewhere else. They're not picking the big tech companies. So that being said, I want to ask you, we have a ton of problems in healthcare still today. Why is it so hard for healthcare to be disrupted?
Disrupting healthcare is the ultimate David versus Goliath story, right? We talked about before that healthcare is about $3.8 trillion. If you actually, compare that to, the GDP of other countries, you'll find that there's a very small handful that could fit in your hand, just one hand, number of countries that are actually, the size of US healthcare. In fact, the US healthcare system is twice the size of Russia's economy. So if you think, taking on one Russia is hard, imagine taking on two Russias, right? And, and the reason is it's because it's consolidated and it's institutional power that stacks up against anybody who tries to disrupt the status quo. So here's what's really happening in every single sort of community in America today. If you look at who are the largest employers, either number one or number two, it's usually the large integrated delivery systems. In every single city in America today, it's the same group of people who have the largest voting power, right? And they're continuing to consolidate. And what do you do when they continue to consolidate? They decrease free market forces, and they decrease free market forces, and then they raise prices. And this is a trend that's been happening across America. And as they continue to raise prices, they find that their payer mix is better in wealthy neighborhoods. And so they continue to open facilities and care facilities in places where in wealthier areas where there's a better payer mix. And they continue to reduce their efforts and their closing care facilities in some of the most underserved communities that are already underserved and already have substantially worse outcomes than wealthier communities. So this situation that I've just described is happening across every single, or almost every single community in America today, and it is a problem. The issue is that disruptors really have to be fearless, and you have to be willing to take on the largest employer, the largest voting entity, the greatest or the biggest company who's actually winning when people lose. Now, this is an important thing I want to bring up. Usually people say, Chris, why are you giving such a hard time to hospitals? We need hospitals. Hospitals saved my life when I had COVID. You need hospitals. The people that work in these hospitals, even the leadership, they're amazing. Some of the most amazing people. The problem is the system. You can't take a group of amazing people and have them win when people do worse. You can't take a bunch of amazing people and say, go ahead and form a monopoly where you're not accountable for delivering outcomes. You're just accountable for enjoying the fruits of people being sick and celebrating financially when people get sick. You can't tell a group, a group of people to say, hey, you know what? Don't just raise prices. When you have all the power and there aren't free market forces, don't just raise prices. They won't do it. It's just, it's too much of an incentive. So what we have to do is we've got to create a different way to disrupt, because David will not beat Goliath by fighting Goliath the way Goliath wants to be fought. David has to come up with a new way of fighting. And we all know how that turned out, right? They used projectiles in those days.
So that being said, how has a company like, so in this case, ChenMed, right? How have you managed to become a large disruptor in over a dozen states in light of those barriers to disruption that you just relayed?
It's very simple. ChenMed operates where others fear to go. We have a unique goal. We want to create social justice through healthcare. And so we gravitate to tougher, long ignored neighborhoods and treat populations that others pretend don't exist. It's really remarkable. You have these large, nonprofit organizations who are created, and they're all trying to figure out, how do we open more facilities in rich neighborhoods? And you're like, wait a second, you exist to try to bring healthcare to places that don't have them. So can we talk about that plan? And you'll find that the plan to actually, grow in wealthier neighborhoods is far greater than the plan it is to grow in some of the most underserved neighborhoods where the problems begin. The way that ChenMed did it is we leveraged Medicare Advantage. In the past, it wasn't very popular. It's now growing in tremendous popularity and growing very quickly. But when we went into it, it wasn't very popular. And what Medicare Advantage allows us to do, it gives us the freedom to address problems up front. And many of those problems are social determinants of health. We've discovered that actually the minority of the problem is actually access to good clinical care, although it is a major problem. The majority of the problem that actually drives negative health is actually built into lifestyles and behaviors and all of these other financial barriers of care that many would call socio determinants of health. And so being in a global full risk capitated environment with full upside and full downside, that means the entire healthcare dollar through a Medicare Advantage gives us the freedom to actually attack those socio determinants of health, to attack those lifestyles and behaviors up front to get a better result later on. And so our proven scalable model, it works in all of these neighborhoods. So we're continuing to go straight into these neighborhoods. Today, we are in about 24 cities across America today. We're hoping to go into another 24 cities in the next 12 to 18 months or so. And the neighborhoods that we're targeting are those exact neighborhoods that you are seeing large systems pull out of.
Yeah, it's one of the things from the first moment you and I talked, it's always been so interesting seeing, because you're in a rare position that you're actually trying to, you're creating a sustainable business, but a business that's helping people, which I think is so cool that you're able to do both, right? And why can't more companies in healthcare do both? And they can, but I don't think still everyone hasn't adopted that value-based care model mindset, right, for care. Although, as I think we talked about a while back, it seems like it's starting to be talked about much more today than it ever was. Because I believe you said even in medical school, value-based care wasn't something that was even talked about much at all, right, for you?
Yeah, think about medical schools. Who pays the salaries of most medical school professors and people who are training doctors? Large hospital systems. Well, large hospital systems aren't designed to figure out how to prevent catastrophic events. They make money from treating catastrophic events, right? And so, that I'll give you an example: heart failure. And by the way, hospitals you need hospitals. They save lives, right? And so heart failure. When your heart is failing, you need somebody to save your life. Okay, you can't breathe. All the pressure is pushing back. By the way, I'm speaking this to you as a cardiologist, right? So I have about the equivalent of about 5 board certifications in cardiac and vascular diseases. And so when you have heart failure, which is the number 1 or number 2 cause of admission in America today, right? It's a major public health issue. It's because your heart is failing, and the blood that's supposed to be pumping forward is going backwards into your lungs, and all that pressure in your lungs puts fluid in your lungs, and you can't breathe. Sounds like a really bad problem to have. And that is the number 1 or number 2 cause of admission in America today. When I left training with all those board certifications and trained at some of the best organizations in the world, with the best professors, I did not know how to prevent heart failure admissions. And at ChenMed today, we have evidence that supports that we believe that almost 90% of heart failure admissions are preventable, and preventable not with fancy, $40,000 equipment or $20,000 tests and procedures. No, preventable with just good old-fashioned primary care. You can prevent anywhere from 80 to 90% of heart failure. And doctors today are not being trained in how to do that. There's no incentive. Why, if you're getting your compensation from treating heart failure, that you would ever want to prevent heart failure admissions? The only answer would be just pure altruism. And pure altruism, sure, there are folks out there that will do it for pure altruism, but it's not just that. You actually gain, you financially win when you are opposed to your pure altruism. So do we still need people to save people's lives when they have heart failure? Absolutely. But could we reduce the number of people who are coming to the hospital with heart failure? Yes, we believe by about 90%. And we need to join that journey. People need to join that journey of substantially changing the way that we manage health, from rescuing people when they're about to die as our primary way of driving health, to moving way upstream and solving the most important challenges that actually improve health.
The last thing I'm going to ask you, Dr. Chen, before we wrap things up, and you already mentioned a few of these points already, but there was a formal question I wanted to ask you. So you already mentioned some of what happened, and some of it involves obviously the government and also just health systems kind of adapting as well. But what could be done to speed up disruption more substantially? Obviously, you're doing your part with ChenMed, but there's obviously other players that are even in different spaces than you that are trying to help as well. What are your kind of last little tidbits on what can be done? And we'll leave that as like a teaser for any future episodes or any other discussions. But
yeah, so first of all, the number of disruptors and the effectiveness of those disruptors will determine the speed of disruption. Very simple. And I believe it's going to be smaller practices who we can unleash to become those disruptors. You're saying, Chris, you're saying you need more competition? The answer is yes. We need 100 more ChenMeds. We need more people that are willing to go into disrupting the existing system. And here's the reason why. You cannot ask the incumbents to disrupt themselves. Taxi companies would not have created Uber. Left alone, companies out there that are making cars, they wouldn't have created and driven this massive push towards electrification of cars. It wouldn't have. And so, first of all, you need to find that disruptor outside. The people who are in power, they will not disrupt themselves. They have it already. They have all the money, they have all the voting power, they have all the size, they've gotten rid of free market forces. So guess what? Why would you change that? So what's the role in government? The role in government is really two things. Number one, think about why we have electric cars today. Why is it that you're talking to all these car companies and they're saying our future is in electric cars? You know who created that? People go, Elon Musk created that. It wasn't Elon Musk. Elon Musk executed on what the government enabled. It was those incentives that created Tesla, and it pushed Tesla to create what they created today. Now everybody said, oh my gosh, that's the future. Now everybody's jumping on board. It is the government's job to sort of push that industry, to push value-based care. And so sometimes it does take some investment, but in the end, you're going to end up in a much better place, right? And now the electric cars, right? They're faster, they're smoother, and almost they're safer. So you're going to get to a better place. The second thing that the government has to do is the government has to protect innovation and disruption. Has to. And the challenge why this is going to be harder than the car industry or the transportation industry is because the industry is much bigger. The government has to take on a fifth of its economy. That's the problem. And so every time there's a change that happens, it's amazing. When we talk to government folks, it's the same thing. They go, it's the amount of lobbying power is very scary. Why? Because the voting power exists in these large incumbents, right? The largest employer in every single city are large systems. And those large systems have gotten rid of free market forces. They're big, and they make money when people do worse. Okay, so it's very hard to take on hospitals, especially when you need them to save your life, especially during a pandemic. There's a lot of leverage. So those who are in government, boy, oh boy, they need a lot of courage because they're going to be taking on something that actually is inherently good, trying to save people, but is very big and does not want to change. So they've got to figure out how to do that. Now, you talk about tech companies, a lot of them have failed. It doesn't mean they should give up, okay? I agree with you. 10 years from now, we won't be going to care at tech companies, but they're gonna be playing a much larger role. And if they keep at it, they're gonna continue to enable those disruptors. And I think that is the key. Tech has the ability to enable disruptors. And so do I think the Googles of the world, the Amazon of the world, are they gonna make a difference? I do think so.
Well, as always, really appreciate you coming on the podcast. I'll listen to your thoughts on just about anything. It's always great. You always explain it so well, and it's always a pleasure chatting with you. Look forward to future episodes, and thank you again for your time today.
Thanks for having me, Jared.